Dear oncologist, when should you send your patient to palliative care? Today. Now, actually, can I come in the room with you? I feel like the answer might be always, but not really. So there are a few times in oncology where I think, we might not be of much benefit, but I think more often than not, we would be of benefit. And let me tell you why. So if you, as the cancer doctor, are seeing a stage 1, stage 2 breast cancer, stage 1, stage 2 prostate cancer, something like that, that is a patient who really may not benefit from palliative care because they may not have that many symptoms or needs. But any stage 4 cancer would benefit from seeing palliative care. Even prostate cancer, because they have a lot of pain at times and they need additional resources at times. We can talk through the treatments, the goals, the plans, the what ifs of the future. We can treat all of those symptoms that come up like pain, nausea, diarrhea, and constipation, anxiety and depression. We can try to help understand someone's home situation and see what resources or equipment we can get into their home to help their journey easier. This does not need to be a patient that's going to die from their cancer to see palliative care. I think most cancer patients could benefit from a palliative referral, and this is just because we can help be an extra support along this journey. This is a hard journey, and they can use as much support as they can get usually. And the other thing is, the earlier the better, because I like to meet people long before they're in crisis mode, long before they're miserable, because once they're already miserable in pain, we're chasing the pain. If we can come up with a plan ahead of time, or when the pain is just starting to creep up and the symptoms are just starting to show up, we have a better chance of heading them off and having better control of them. And don't worry, I'm not going to undermine your plan. I'm not going to tell every patient not to get chemotherapy and radiation. I really want these people to have the best quality of life possible and the best longevity possible, if that's a reasonable plan. So please, by all means, send your patients to me, oncologist. I want those patients and I want to meet them early. They can be the patients that are going for cure. They can be the patients that are on maintenance chemo. They can be the patients that are not going to be cured and are likely going to die from their disease. And those are the people that I especially want to meet now, like yesterday. But the other thing is, if you're a cancer patient right now and you're going through a cancer journey, please ask your oncologist for palliative care, especially if you're having symptoms, you're having pain, you feel like you need additional support and resources. We are here for you. If you liked this video, make sure to share it with someone who you feel like could benefit from it as well. And as always, follow along for more.